departing Salem Memorial Hospital with a suspected myocardial infarction. Condition is stable. Inbound to Missouri Baptist Hospital. ETA is 45 minutes.
I was awakened about 10:15 or 10:30, and I had some kind of a cold, chilling kind of feeling at the base of my throat. And then, I guess about 15 minutes later, my left arm started getting, felt very heavy and kind of tired. And that was a first warning sign. I woke Becky up probably around 11 o'clock. And I said, I think we have to go to the hospital in Salem because I think I may be having a heart attack.
Well, he's not an alarmist and he's not a hypochondriac, and he did look horrible, green at that point, and clammy. So I didn't ask any more questions. I put my jeans on and we got in the car, and fortunately we did know where the hospital was, or Eugene had noticed the sign, so we made the drive fine. And
I went into the ER, and there was 2 nurses in there, male and female. And they said, "Can we help you?" And I said, "Yes, I think I'm having a heart attack." And then they put me on the table and started, I guess they were giving me morphine and putting, doing all sorts of tests. And they were wonderful. They were really great. And they said, "Yes, you're having an acute heart attack."
When a heart attack starts, the blood vessel is usually totally occluded with blood clot. And during that time, the heart muscle is not getting any blood or oxygen. If we don't get blood into the heart muscle quickly, the heart muscle cells will go on to die. Most patients that present with ST elevation myocardial infarction present to hospitals that don't have tertiary care capabilities, such as cath labs. In fact, the great majority, over 80%, will present to hospitals that don't have cath labs.
And I could hear the saying that there was going to be a helicopter arriving in about 10 minutes, and it was going to be air vac out.
Well, the Heart LifeLine Alliance is really a team approach that encompasses the rural emergency room, and in fact, even before that, the rural EMS, the transport systems getting patients from the emergency room to Missouri Baptist, and then of course our emergency room and our cath lab teams. And we try to gauge the success of the whole system, but they're clearly different components.
There was a paramedic and another nurse that go with a helicopter. They came in and they strapped me onto the gurney and wheeled me out.
Okay, can you rate your chest pain for me? 1 out of 10.
3, 2. And so they got me in and put me down this little chute right by the pilot. And I started up the motor. They put earphones and a boom mic, and they were talking to me and wondering stuff like that.
IV fluids up.
Well, when a patient presents to a rural emergency room, the first thing that happens, of course, they're complaining of chest pain. The first thing that's done is an EKG, and that's almost always done within 5 minutes of arrival to the rural emergency room. As soon as the EKG is read, which is almost immediately by the EKG technician, who will then hand it to the emergency room physician, a call is made to Missouri Baptist Medical Center. The EKG is reviewed with the emergency room physician at Missouri Baptist Medical Center, who confirms the presence of an ST elevation myocardial infarction or heart attack. That is then transmitted to the cath lab, where the cath lab team is immediately activated, and the dispatch, air transport dispatch, is sent for the patient to bring them directly to Missouri Baptist.
And they were pretty good about giving, take about 45 minutes. And then they say, we're about 30 minutes out, and then we're about 20. How are you doing? So I finally said, I'd like to ask a question. And they said, what? And I said, am I going to make it? And I appreciate it. They said, well, we think so, but we can't guarantee. I mean, you are having an acute heart attack. And we're just going to do the best we can. I said, thank you very much. It's a wonderful system. care of that. And they were great.
Emergency rooms across the country are now rushing to try to make sure that all of their heart attack patients can get from their emergency room into the cath lab within 90 minutes. We were very successful in doing that, and we wanted to try to transport that type of success to the rural setting. Traditionally, without a program like this, they'd be treated with a blood clot dissolving agent, or there would be a number of minutes or even hours spent trying to get the patient to a center like Missouri Baptist for an emergency angioplasty.
Great.
Hi guys. Thank you.
Hi.
Hi Mr. Ruth, my name is Barbara. I'm
Hi.
one of the nurses in the Cardiac Cath Lab.
Hi, I'm Leanne. I'm also from the Cardiac Cath Lab. We're going to be taking you straight upstairs.
This setting allows, with one call, the local emergency room can get to us and get the patient here so that we can hopefully get the artery open, with our goal of having the artery open within 90 minutes of presentation to the local emergency room.
I'm going to get you up there and Dr. Cole's already waiting on.
Okay, good.
Okay?
Good.
And this whole procedure will take about an hour, sir.
All right.
And your family will be coming.
Okay.
Who's going to call? We'll make sure we get your blanket.
We'll make sure we have very warm blankets in here.
Mr. Ruth, hi, I'm Dr. Cole. I'm one of the heart
Yeah.
doctors that work here at Missouri Baptist.
Yeah.
I'm going to be doing your test today.
Okay.
Are you still having chest pain, sir?
Yes.
Okay.
And
when did the pain
then I
start?
drove back to Moab, and by that time, it was light. It was probably 7, maybe 8 by the time I got here. And he's happily,
Having breakfast.
having breakfast with pillows all around him, and the nurses paying attention to him, and so he'd had the procedure, and everything was fine. I feel like we were so lucky, just happened to be lucky.
Here I was out in a rural area, wonderful, competent nurses and the doctor in the ER, and they really do their job. But they didn't have the capability of taking care of me out there. And then 45 minutes later, I was being saved.
God bless that hospital and the service.
It saves lives. I mean, I would not be here today if there wasn't this program.
People were not only compassionate but competent. It was very clear to me that he was going to be okay. That was a miracle. That was a miracle. And that made all the difference in our lives.